Good morning. Is the mic on? Yeah. My name is Bob Bergamini. I have the privilege of moderating the second session. I'm here representing the Supportive Care Coalition. My real day job is as a pediatric oncologist and director of the Mercy Kids complex care team in St. Louis, Missouri. So Blythe will be keeping the pediatrics in focus, at least in this session as well. This session is devoted to addressing socio-cultural differences as we address the needs of seriously ill children and adults. And I'd like to key up this session with an experience from two separate patients. One was a refugee from a war-torn country who developed cancer, developed some complications, was being fed intravenously with TPN, and was astounded that anybody thought that his life was worth so much money when he found out the cost of his chemotherapy and the TPN. As often happens with refugees, they don't live in the best part of town. So he had a gunfight that went on outside of his house, and a shotgun blast penetrated the living room window, and a couple of pellets penetrated his TPN bag. So he had experience in diving for cover, and then he saw this very expensive drug that he felt very guilty being wasted, just dribbling out onto the floor. So he grabbed the first thing available, which happened to be a coffee cup, to catch the TPN. He went to a different part of the house and managed to put the TPN back into the bag, then realizing that he had grabbed a used coffee cup. So he calls me through the exchange, and the exchange patches the call through, and he says, so this thing that you Americans call peppermint mocha, how does that go with TPN? And so when I finally realized what he meant, we got him to the emergency department. He survived his multifloral sepsis just fine, and with some social service agencies' help, we managed to move him to a slightly less dangerous neighborhood. In contrast with that is a 14-year-old who I saw not too long ago, who is a survivor of stage 3 Hodgkin's disease, has some chronic respiratory and pulmonary issues as a result, and I always give teenagers the option of speaking privately when they're in for an exam. And so her first comment during her private time was, you know, it's cold and flu season. And I was expecting some joke that I hadn't heard before, except she said, do you think this year I should draw up a will? And I said, no. But I knew why she was thinking that. She lives just 2.5 hours south of St. Louis in an area of great beauty in the Ozark foothills. And Ellington, Missouri has just lost its critical access hospital. And so now, when she thinks about an exacerbation that might require treatment in an emergency department, she and her parents have to grapple with the fact that from the time she's loaded into the ambulance, it's an hour to the closest medical facility. And in the 5,000 square miles that comprise the 6 counties around Ellington, there are a total of a maximum of 8 ambulance crews. Some of them are volunteer. So they got to get to you first. A very different problem as we try and address the needs of seriously ill patients. When you think about rural settings, people talk about the beauty, and certainly the Ozarks are a very beautiful area of our country, but they camouflage the great needs that hide in patients with serious illness in those communities, and the battles that they face. And for my patient, it's all well and good that Medicaid will pay for her to get to the hospital that's an hour away, but the transport home is considered elective by Medicaid, and you need 72 hours to set that up. So different problems across different settings. Again, referencing pediatrics, for those of you that have children or grandchildren, I'm sure you've seen the movie Kung Fu Panda. And the great revelation that takes place for Poe at the end of the movie, that is, there is no secret sauce. So we have no unique battle plan that will address all of the needs. But what I hope is that people will be inspired by the innovation and passion of the speakers to create the solutions that their specific patients need in a wide variety of settings. And so our first speaker, excuse me, is Shanta Chambers. Shanta is the Executive Vice President for Health Equity Initiatives and Community Engagement for the Patient Advocate Foundation. And when I asked her to highlight something that she thought was the most important, she said it was important to highlight the societal context that the health system delivers its services in. I think it's a great segue and a great start to our session.